Hello, my name is Sasha Thimler, and today I am going to be demonstrating how to insert an NG tube for my patient. So first of all, I'm washing my hands here, and I am going to enter the patient's room, and we're going to start off discussing the order to place an NG tube and some patient teaching that's going to go behind that. So I'd walk into the room, I'd introduce myself, I would talk with the patient about some of the signs and symptoms they're having. My patient is feeling bloated, is very nauseous. They're here at the hospital with a bowel obstruction, let's say. So they're a little bit uncomfortable, having some pain. So I would explain to my patient that what we can do for you is we can insert an NG tube, which they might not know what that is, but it's putting a tube into your nose. And we can do that to hopefully relieve some of the symptoms, the nausea and fullness that you're having. I need to be honest, this is not a comfortable procedure to have completed. There's things you can do to help me get it in faster so that hopefully it's not as uncomfortable for you. But I will be honest, it's not a comfortable procedure, but it does not take that long. So hopefully we can go ahead and get that placed quickly. Patients are allowed to refuse this if they would want. Education's a big thing. You want to explain, that no, it's not uncomfortable, but yes, hopefully your symptoms should be relieved by this. So the patient has decided that yes, this is something he would like, so he has given me the okay to go ahead and insert the NG tube. So with that being said, I would then go ahead and get all my supplies. I would need a bunch of different things. So for this recording, I did go ahead and collect my supplies ahead of time. So I have the proper supplies that I would need here. And what I would want to do is kind of explain to the patient that we're going to start out by assessing your nares, your nostrils. I'm going to be asking the patient here if they've had any facial trauma, any nose surgeries, have you been in any motor vehicle accidents, anything that I should be aware of that we should avoid a nostril. So the patient has no complaints of surgeries or problems with the nose at all. So I can kind of look and assess the nostrils here. Both of them look pretty equal to me. So what we can do is plug each side, ask the patient to breathe, and then we can plug the other side and ask the patient to breathe and ask them if one or the other worked better. So for demonstration purposes, we're going to use the right nostril. So the patient feels that will work well, and that's the nose that or the nostril that we're going to use. So I also want to explain to the patient that what we're going to do is we're going to tilt the head back a little bit. I'm going to insert the tube a little bit to about the end of the throat. And then we're going to have the patient, I'm going to have you tip your head down. We're going to go chin to your chest. And then as I'm inserting the tube, I'm going to be giving you water to drink through a straw, and you're going to want to drink and drink and drink. And that's going to help you swallow the tube better, and it'll go down more smoothly. So just making sure that my patient is able to help with that kind of stuff. So looks like I have everything here that I need. You would want to make sure that your patient is not laying flat for this procedure. You want him sitting up as best as you can here. So I have him propped. We don't want him falling here, so I have him propped on the chair for demonstration purposes. So we will go ahead and get started here. So I have my tube, and I don't have a tape measure, so for demonstration purposes, I'm going to go ahead and measure with my tube. So you want to use the nose to ear to xiphoid. So we're going to go ahead and go from the nose to the ear, and we measure in centimeters. Then from the ear, you want to go down to the xiphoid. And about here. So I would say that now 51, 2, 3. So we're at the 53 mark. Average is about 55, so that's good. So for demonstration, or for my purpose, I am going to go ahead and mark this with some tape because once I'm inserting, I don't want to put this too far in. So 1, 2, 53. All right. There we go. Okay, and it's important to note that this is not a sterile procedure. This is a clean procedure. If you think about this as going into the stomach, so of course we want to keep it as clean as we can. We wouldn't want this going on the floor. We wouldn't want to be touching it or anything, you know, as least as possible. But just note that this is not a sterile procedure. So I have this ready to go, and what I have here is some lube that we're going to use. And I'm just going to set this in here for now. And that's not going to want to stay in there. So we're going to say that's in the container there. I'm going to get my syringe ready to go. And I'm going to take this piece out. This piece is very important. I don't want to lose that. I will be needing that later. So I'm going to put that right on the table there. So I've got my syringe ready to go. I want to put this over my patient to keep them nice and clean. There we go. All right, so you do want to wear gloves for this procedure. You may be coming in contact with some contents that, you know, either are coming out or saliva with the mouth. So you always want to wear gloves for this. I also would want to have a piece of tape ready to go once I have it in. So I'm going to go ahead and there we go. Split this in half. That way I can secure the tube once we have it in his nostrils. So now that we have assessed the nose, we're going to use the right nostril. The patient's agreeable, ready to go. I have a cup of water. I'm going to give this to you, and I'm going to have you hold this. And when I tell you to drink, we'll have you drink, 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 okay? So we're going to say that the patient is holding the cup of water and is able to drink on their own. All right, so. Okay, I have this ready here. I'm going to put this down here. All right, so we're going to tip up the head a little bit, and I'm going to insert just a little ways. And I'm going to go to the end of the throat there. Okay, so now the patient's going to tilt their chin down. And I'm going to have them drink, drink, drink. And I'm going to insert this. And it seems to be going very nicely at this point. And I'm going to go up until the tape. Okay, so I would take the patient's water cup here. I have it here. And for my demonstration purposes, I want to go ahead and get this secured right away so that it doesn't fall out at all. So I'm going to tape it on the nose here. And you just go around one way and then around the other way. All right. So now at this point, you would probably have some secretions coming out of here. Okay, so we want to test the pH. So I'm going to go ahead and aspirate back. And sure enough, I'm getting some right away. So I'm going to go ahead. And now secretions could come out here. So you want to be kind of careful. And I'm going to go ahead and put this in. Okay, now I'm going to aspirate back 30 and I'm going to put this again in the clear tubing. Now, my pH needs to be tested. So I'm going to use my pH strip, and I'm going to test that. And we'll let that sit for a second. Now I'm going to check for placement. So I'm going to be putting this 30 milliliters of air, and I'm going to listen with my stethoscope to see if I can hear a swooshing sound. All right, so down in the abdomen area, and I'm going to listen. Yep, and it was clearly heard. I could hear it really well. So now I know that this is in a good place at least. Of course, you're going to want to check placement with an x-ray. So we'll go into that in a little bit. So at this point, I have a pH. Let's say the pH is 3.8, we'll say. So normal is generally like 1.5 to 4. But as the number gets higher, it's more basic. So you are at a higher risk for aspiration. So you're going to want your numbers to be lower because that'll be more acidic. So it's important that you check the pH and know the normal levels. And then also the x-ray placement is something that we do. And as nurses, once we have the once we have the NG tube placed, generally then it would be our responsibility to go ahead and place an order to have x-ray come up and check for that placement. So another thing I want to note here is the blue tube here. This is an air vent. This is to be used only for air if it's needed. Otherwise, you would never suck anything out of here. You would never push any meds through here, never hook up a tube feeding through here. So this is strictly an air vent. So what I'm going to do is I'm going to get some tape here, and you want to secure this. So first of all, you go around the tube. And even before I would do this, they could still have secretions coming out here at this point. Sometimes they, have a lot if they are have a full stomach or something like that. So what you can do at this point is use this piece that we wanted to keep, and you can put this back in here. And then at this point, you would hook it up to the suctioning. So I don't have any suction tubing that I could use, but it gets hooked up to the white tube here, and you would put this on, and then it would be hooked up here, and you would turn it on to like a low intermittent suction. So then that can fill up in here, and of course you're always going to want to document how much you have, and then also like the coca and that type of information. So now that this is hooked up to suctioning, we have a safety pin, or in my case, I'm going to use another piece of tape. But what you want to do is make sure that there's enough give that the patient can turn their head, look up and down without causing too much tension. Now, you don't want coils of it, but just so that they have enough room to move their head around without pulling it out. So you would never pin to the tube. You always want to put a piece of tape on, and then you would pin to the piece of tape. So I'm going to go ahead and pin that down. And then you want to assess how your patient is doing. Of course, they're not going to be very comfortable, but ask them if they're still feeling super nauseous. Does their stomach still feel distended? More than likely, if they have secretions flowing out here, they're going to get some relief from that. Now, I do want to note that as you're inserting this, if you were to have problems and it did not insert nicely, there's a couple different things you can do. So first of all, when you're inserting, if you're meeting resistance, you can look with the pen light. You can open up your patient's mouth a little bit. In with your pen light, you can look, and in the back of the throat, you can see if the tube is recoiling. Now, let's say that, yep, it's recoiling, it's not going down. The patient's, it's not being able to be swallowed. They're drinking and nothing's happening. You can, at that point, remove it, take it out. This is not a sterile procedure. So if you want, you can try the other nose if there's no contraindications. And you can try using that nair with the same tube. You don't need to go and get a new tube. So that would be something that you would want to check if you're having problems. So now we have suctioning going. We have explained to the patient, that it's suctioning now. You should have relief of symptoms. One of the big things you want to do is documentation. You can document, that you have the NG tube placed. You'll want to document how the patient tolerated it. You'll want to document what you aspirated. If this fills up really fast, you'll want to empty this out, document the coca, and all those types of things. Then this is where you would go ahead and place your x-ray order. That you have the NG tube placed. Now they'll come up to get the x-ray to confirm the placement of that. So I'm going to go ahead and take my gloves off. We do have tissues here if the patient were to, need to wipe their nose, or, if they were kind of drooling from, it going down their throat. We do have that here. So I'm going to go ahead and document. I'm going to wash my hands here. And then that completes the skill.